Welcome to a broadcast of the recent Lorraine County Commissioners' General Meeting. Unless otherwise announced, meetings are held Wednesday morning at 9:30 at the Administration Building, 226 Middle Avenue, 4th floor, downtown Elyria. These are public meetings and you are invited to attend. Agendas are posted prior to the meeting at www.loraincounty.us. Click on Departments to see the Commissioners page, then click on View Agenda.
Morning, everyone. If you'll please stand for the Pledge of Allegiance. And our prayer this morning comes from Romans 14. Let's agree to use all our energy in getting along with each other. Help others with encouraging words. Don't drag them down by finding fault. And who has our dog this morning? Lori does.
Come on, little cutie. I always get the little ones. There's a little cute one today. Look at all this energy.
Look at
Come
that
here,
energy.
you.
Wow.
Look at
Wants
you.
to
Look
run.
at you go. You got so
Wanna
much
run.
energy.
Oh, yeah.
We have a little poodle mix for you today. It's a little female. She's pretty young, maybe 3-4 years old or so. She's available tomorrow, so if you'd like to come down to the dog kennel and pick her up, take her home. She makes somebody a fantastic pet. And we have 31 dogs, so we really need your help. We're getting kind of full, so come down to the kennel, check us out on Facebook, and remember, adopt, don't shop. Thank you. She's a happy little dog, isn't she?
Yeah, really rambunctious there, huh? Madam Clerk?
9:45, we'll have Elaine Georges from Alcohol and Drug Addiction Services. Under Resolutions, Investments,
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Appropriations,
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Transfers,
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
No advances, no repayments, requisitions,
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Travel,
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Bills,
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Under the Commissioners, authorize various personnel actions as indicated on the summary sheet for employees within jurisdiction of Lorraine County Commissioners.
Okay, and since the administrator's not here today, just want to inform everybody, we do have some action that's required on the personnel summary sheet. So the board will go into executive session to address these matters.
You have to state what they are.
We've got new employment hire, community resignation rather, community development. We have appointment to the Keep Lorraine County Beautiful Advisory Board, reappointments to Alcohol and Drug Addiction Services Board, also appointments to the Mental Health Board, and that covers it.
Approve and waive the reading of the minutes of June 15th and 26th.
So move.
22nd, sorry.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Amendment Resolution 16333 adopted June 1st, 2016, awarding the 2016 roof replacement repair contracts. Said amendment is to reflect Absolute Roofing Construction, Inc., Cleveland, for 374 Broad Street, including alternate 1, Record Center, Juvenile Pods, and 322 North Gateway, and 42110 Russia Road, in the amount of $221,300, and WeatherTight Construction LaGrange in the amount of $10,000 for 45999 North Ridge Road. All other provisions of the resolution will remain the same.
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Under Children and Family, approve and enter in a purchase service contract with Cleveland Hearing and Speech Center for Help Me Grow for Sign Language Interpretation Grant for fiscal year 17 in the amount of $500, effective July 1st, 2016 through June 30th, 2017.
So move.
Second.
Discussion. Mr. Lundey.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Approve various contracts for FY17 Help Me Grow Part C Service Coordination, Evaluation, and Therapy Consultation effective July 1st, 2016 through June 30, 2017. One for Children's Development Center for Therapy Consultation, OT, PT, and Speech in the amount of $10,660. And Neighborhood Alliance for Service Coordination and Evaluation in the amount of $519,140.
So move.
Second.
Discussion. Mr. Lundey.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Under Community Development, award contract to Concrete and More, Inc., Avon Lake in the amount of $4,620, which includes a contingency for any unforeseen change orders for Eleanor St. John at 114 Morewood, Avon Lake, to receive grant assistance from the CHIP Program Year 14, home repair for storm sanitary lateral separation.
So move.
Second.
Discussion. Mr. Lundey.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Under Job and Family, advertise request for sealed bids for non-emergency medical transportation for Job and Family. Advertised in the Chronicle on July 11th and 18th and open at 2 p.m. on July 25th.
So move.
Second.
Discussion. Mr. Lundey.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Under the Clerk Courts, advertised for sealed proposals for Courts Case Management System. Notice to be in the Chronicle on July 5th and 12th. Pre-bid meeting on July 25th and open at 2 p.m. on August 8th.
So move.
Second.
Discussion.
I understand we have our Clerk of Courts here today, Tom Orlando, to kind of give us an update on where we're going on this. Good morning, Tom.
Good
Morning,
morning.
Tom.
Morning.
Good morning. Good to be here. Just to add a little more information to where we're at, we are asking for approval from the Board of Commissioners to release a request for proposal to the public for a new case management system on what we discussed. We were here a little while back. If approval is granted by the board, a notice to the vendors will be published in the Chronicle and other mediums. Vendors will have 5 weeks to complete and submit their responses. This is a very intense RFP. There's a lot there because we have 5 divisions that pretty much have broken down what they expect from a new case management system, so there's a lot to satisfy there. So what we're going to do is we're going to have a mandatory vendors conference for all companies that submit a proposal. The plan is to have that on July 25th at the Justice Center in our jury commissioners room, so we can hold everybody. And at that time, we'll answer any questions the vendors may have to complete their RFP, so it's completed properly. All proposals will be due by 2 p.m. on August 8th, and they'll be sent here. And Casey Saunders will hold those sealed bids. We will then open those immediately following the deadline, which is August 8th, and we're going to do that in meeting room D here on the 4th floor of the administration building. What we did in our RFP is we allowed us, our case management committee, 180 days to evaluate the responses and choose the top vendors for demonstrations. So we wanted to give ourselves plenty of time. We don't know if there's going to be 2 proposals or 20. And we're going to have to really dig in, and we have a scoring system in place that the 3 individuals from each division will be scoring these case management systems, and we are going to bring in at that point, within that 180-day period, the top vendors that have scored well. And we don't know if that'll be 2 vendors or 5 vendors. We haven't determined that yet. At that point, those vendors will come in for full demonstrations, which will take quite a bit of time as well, because if there are vendors that can satisfy all 5 divisions, then all 5 divisions are going to want to have a demonstration that's going to be targeted for them. So this is basically, if you can pass this resolution, will give us the opportunity to take the next step. We'd appreciate that.
Question
Any
for you,
questions?
Tom. Yeah, good. How many pages do we end up with? Like Lucas County's?
400 maybe, or-
Not quite as big as Lucas County.
Okay,
but-
all right. I just remember you saying how big Lucas County's
Yeah.
was.
I'd say maybe around 400 pages.
Is there the ability, do you think, one vendor to be able to handle all 5 divisions? I mean, is there
That's
No.
what we're hopeful, and I was just recently at our Ohio Clerk of Courts Association conference, and a lot of the vendors were there, and the word is out. I mean, we're the 9th, I believe the 9th largest county in the state, and to have the whole Justice Center together on this. They're all anxious for the RFP to come out so they can go ahead and submit proposals. There are some counties that have pretty much the whole justice system in one vendor's hands. Some of them are smaller than us, some of them are larger, and that's where it kind of gets tricky too,
Right.
because not all counties are the same. So we're hopeful that one will be able to satisfy all of us. We may be in a position where we might have vendors team up, where you might have one vendor that can handle everything maybe but the electronic filing, and then they would team up with another vendor to provide that. I've seen that happen in other counties as well.
So that, there's the ability to do that. We're not just looking for all the,
Yeah.
everything in one pot that we'll be able to bring.
That's correct.
Commissioner, if I will, we are setting it up as alternatives. But the key thing is that they be able to communicate between each other. That's, whatever we do, it's going to have to be, I forget the term, but it's
Integrated within each other.
integrated
Be able to
systems so
communicate
that
and
we can
interface.
communicate. But, you know, if we can do it with one vendor, we will. If we need to have several, but we've opened it up so that it can be proposed in both fashions.
It's significant expenditure. I'm just hoping it can all go right. You don't want to have some of the nightmares we've heard in regards to case management systems and things going south, so.
Right. I can tell you this, Mr. Kalo, there are vendors that are telling us that they can handle everything. Now it's going through the process and actually seeing that live where they can do that, so. But
We
we are
appreciate you
hopeful.
coming giving us that update before we go out on this thing. I mean, it's a big purchase, especially in light of our issues with all the other finances, so, but I understand the need.
Absolutely. Thank you.
You'll be meeting with them in person as well, too, to have them come in and do demonstrations?
Well, once the request for proposal goes out, it'll be up for 5 weeks. After the second week, and we had discussions within our case management team, whether or not we're going to make the vendors conference mandatory or not. We decided to make it mandatory. If someone's that serious about this type of proposal, we want them here, so we don't have to deal with a situation later where they said they weren't clear on certain parts of the proposal. So yes, we will be meeting with all the companies that are going to be submitting proposals at a vendors conference. They're all going to be there. They'll all hear the question and answers together, so everything's wide open and known to everyone.
Okay. Yeah, there's no question that the need is there, but I think, as Commissioner Kalo pointed out, probably couldn't come at a worse time with our finances, but we know the need is there, so we're certainly hoping that the judges and yourself will all be on board and help us bring more revenue into this county, which is badly needed. And, you know, I talk about it all the time, and I just can't state strongly enough just how bad our finances are, very bad. But at the same time, if you're a homeowner and you know, your roof is leaking or you're having all kinds of inefficiencies and issues with your home, electrical, plumbing, whatever it may be, you still need to get it done. And so, but we're going to have a lot of debt we're going to have to service on this. So get ready to help us out.
Commissioner, again, if I could follow up just a little bit. What we're going to do after we get all those initial proposals, then, as he said, we go through and make a initial ranking where we get however many that we think are really prospective. Then we're going to actually have them come in and do full-blown demonstrations, and then we're going to re-rank them. So,
It sounds like you have good processes in place to help you make the best decision, so,
We believe so, yes.
and hopefully the most cost-effective.
That's can be very important as well.
Yeah.
Yeah, it's great, you know, to get everybody on the same page. So really want to compliment everybody on board and are involved. And I've had a chance to attend a couple of the meetings, and it's just it's the only way we're going to get things done around here. We need to be working together.
And we appreciate that, and as I've stated before, we're doing all the work in-house. We didn't hire any outside consultants. I know Lucas County paid $250,000 for a company to come in and handle the process for them, and the prosecutor's office, and Jerry included, has been very involved. And when I asked my chief deputy, Lisa Liu, to be the project manager for this, the first thing she told me is, you know, I'm not familiar with any of these case management companies outside of the company we're dealing with. And I said, that's great. I want someone that's not going to come in with any biases or any relationships. We're going to do this totally open, and you know, she's done a great job. So,
Good job.
Good work.
Thank you.
Thank you.
thank you.
Thanks, Tom.
Mr. Lundy.
Aye.
Mr. Kayla?
Aye.
Ms. Kowski?
Aye.
Engineer, enter into lease purchase with Akron Tractor and Equipment and Kansas State Bank for the New Holland T475 tractor with side and rear Alamo mowers for the county garage in the amount of $66,713.90 to be paid from the MVGT account.
So move.
Second.
Discussion.
Teresa, did we find out what that second signature was on that? Where I had that question?
Yeah, Shelley said it's Commissioner.
Yeah, okay, it is.
Both?
Okay, all right then, thank you.
Okay.
Mr. Lundy.
Aye.
Mr. Kayla?
Aye.
Ms. Kowski?
Aye.
Under Sheriff, approve an addendum to Cirrus Technologies for the inmate phone service at the jail. The addendum is to reflect some increase due to changes in some federal regulations.
So move.
Second.
Discussion. Mr. Lundy.
Aye.
Mr. Kayla?
Aye.
Ms. Kowski?
Aye.
Would you like to do that now or just finish?
Well, I think we should go
Elaine?
Elaine.
Okay. At this point, we'll move to to our appointment today with Elaine Georges from the Alcohol and Drug Addiction Services.
Want to give them a minute time? Do you guys got to leave, get back to the office or anything?
We do.
Yeah,
go
if you
ahead.
need to go.
Take a minute or
Sure.
so.
I gotta go this way. Oh, good morning, Commissioners.
Good
Thank
morning.
you for
Good morning, Elaine.
putting time on your agenda to hear from me on behalf of the Alcohol and Drug Addiction Services Board of Lorraine County. And I'd like to continue to thank you for the appointments you give to our board, which is a very engaged and committed and active board. Today I'm going to talk about where we're at today, the epidemic, and where we need to go, we feel, from our board's perspective. We did just get recently, yesterday, the millage requests that you forwarded to the auditor. So our board will have an emergency meeting come real soon to kind of work within a timeline, if they so choose, for soon. I wanted to just show you, we're running an ad right now specifically to the heroin campaign. It's not the Get Naloxone bill, it's Getting Help. One of my staff actually named the girl. But basically, because this epidemic is touching every border and boundary. And this one ran on Monday, and we took amazing number of calls that day. So it's just amazing what's going on. So our board has been here since 1989, statutorily created for the Ohio Revised Code, Section 340. The commissioners at that time voted to create a separate board, and that's how we've been functioning since then. There's an 18-member board. They're volunteers. 12 are appointed through the county commissioners, and 6 are appointed through the Ohio Mental Health and Addiction Services, and they all must be residents of Lorraine County. Either in an advocacy role, there's a requirement that one has to be a family member of someone who's received services, one has to be a clinical expert, and one has to have received services in their past to bring to our table. Over the last 25 years plus, we've been solely reliant on the ever-shrinking state and federal budgets, and that's it. We've written a lot of grants, and we've got a hint that we may get a grant come soon. But, we work off of grants and then the allocations, however Columbus chooses to dedicate them. And about 2 years ago, Medicaid has been pulled away from the board system, and it's directly from Medicaid Ohio to providers. So it's kind of out of our reach, but we still have statutory role to oversee substance abuse treatment and prevention in Lorraine County. I know that, as an ADIS board, we are the last ADIS board left in Ohio, but we're recognized locally, statewide, and nationally as one of the experts with our focus specifically on substance abuse treatment, prevention, and recovery support. With the Narcan pilot, we were on the phone amazingly with the Office of National Drug Control Policy and asking how did we do this. With our peers around the state, with the WACABA, we worked together on that. We've really focused and honed in on this opiate and heroin addiction solutions with our providers and the innovative approaches that are coming soon with peers and sober housing systems.
And you guys meet together with the mental health board, too.
Oh,
It's not-
we've had a joint board committee that has been around since 2007. We generally meet every other month. There are 3 members from our board, 3 members from their board. Myself and the executive director, we kind of just facilitate the meeting, but they've continued to meet on common issues. They handle all of our backroom claims, our infrastructure to process data, and then we work together on the integrated services partnership as well. We can do more, and we keep looking at more. We work with them and Health Department with a whole bunch of school-based initiatives and with reentry. Actually, Charlie Neff is, I think, Vice President of the reentry, but one of my staff is on the reentry piece. So we kind of work together, and then we maintain our peer focuses. Some things, examples, I mean, 4 years ago, we were one of 3 in the nation to get a specific grant for recovery and resiliency for the city of Lorraine. We are one of 697 communities with the Drug-Free Communities and Support Program. We're in our 10th year with that. We were behind the scenes assisting Lorraine County as the successful pilot for Narcan, which has since been replicated for first responders around Ohio and the nation. In fact, our pilot was also highlighted in like emergency room personnel protocols for the state of Ohio as well. We lead Ohio's behavioral health authorities, which are the boards around us, for a recovery-oriented system of care. If we really acknowledge addiction as a disease, we need a recovery-oriented framework, and we kind of brought that in by going to a conference about 11 years ago, and so we're kind of driving that. I'm actually the chair of Ohio's ROSC Implementation Committee with another board. And, you know, we have one of 3 communities in the city of Elyria from Ohio that's toughened their social host laws. So we don't only just work with providers for services, we work with communities. So now in the city of Elyria, if an adult is selling or providing alcohol to a minor that's not their child, they will be charged with neglect. And we're working with a couple other communities to do that kind of environmental change for healthy communities and safety and to raise kids drug-free in Lorraine County. Last year we did partner with LCCC and the Licata Way to open the Care Center, and that's just an on-campus right now at their main, and the goal is to expand that throughout their campuses. We're a partner of the Lorraine County Health Improvement Plan, and our role specifically is to coordinate the goal that's to reduce deaths due to overdose from opiates and heroin. We're also on the access to care, the reducing suicide, and the reducing tobacco components of that. You could see a variety of places where we are, and it's everything we do is in collaboration because of the way substance abuse intertwines its way throughout every other system and every other issue in the community. And we are the fiscal agent to the county's Drug-Free Community Coalition, as well as the Lorraine County Fatherhood Collaborative, which is limping along but growing up, I'd like to say. We've got a variety of service providers. We fund Big Brothers Big Sisters. We're about to add Firelands Counseling and Recovery Services as of July 1st to our menu. The Licata Way provides prevention and treatment for Lorraine County. Let's Get Real is a peer support system. Lorraine Umadop is an urban minority outreach prevention entity. New Directions, Orca House, and Stella Maris are not providers in Lorraine County. They're in Cleveland, but they help complete our continuum care for residential and subacute detox services. The difference between those 3 and our other agencies, our commitment with them is that they do not accept a Lorraine County client unless the referring entity has a care plan of where they go afterwards, because we just don't want to see those critical services recycled. So they'll take our admissions, but before they do, they know the next place immediately where the client will go, and if even there's a gap, they'll hang on to the client for us. And then Communities That Care is our Drug-Free Community Coalition. Our board last year created a strategic plan to secure financial resources, and we just updated it. And in fact, you do have some pieces in here that are draft. We've been working on some updates for a variety of reasons with rates and other services that are coming online. But we currently serve about 2,300 clients in our system, which represents about 10% of the residents that have alcohol and other drug disorders according to the national surveys in our community. So we're hitting about 10% of the people that need help through treatment. We do also strongly, and we really want to do more of investing in school-based, individual, and community-based prevention. We can't just do one of those without ensuring the others. The example of working with a social host ordinance is balanced with providing school-based programs for students and then working with communities to help raise, their mindset for prevention. And, we're addressing the impact across criminal justice, child welfare, healthcare, employers, and the workforce. Addiction is a chronic disease, and so if we believe that and we think about that, it's just like heart disease, diabetes, and cancer, which could be fatal if left untreated. People of all ages, classes, and ethnic backgrounds can get into addiction. And drugs change the brain. That's the organ that it attacks. And so to think about that, we can't just put 28-day programs for people and expect them to behave differently. We have to change their whole behavioral thinking and the environments they're in and give them opportunities to change their behavior, which takes time. People are never cured from addiction, but they can move into recovery, and relapse often is part of the recovery process. So we need to be there as a safety net when we can, how best we can. There are economic costs all over the place. This one specifically for excessive drinking, and that's something our board pays attention to regardless of an epidemic. You know, all of the drugs of addiction. This is specific to excessive drinking, losses in workplace productivity, healthcare expenses, law enforcement, criminal justice, motor vehicle crashes, just specifically about drinking. So we pay attention to that as well, but we are really focusing on the heroin and opiate epidemic as a priority. According to Start Talking, the effect, again, on the workplace for substance abusers, they're a third less productive at work, 10 times more likely to miss work than non-abusers, and use about 300 to 400% of an employer's medical benefits. So the work we do crosses over, and so we hear often that even employers are having a hard time finding people that can pass drug tests. So again, this crosses over the work and the communities and the impact. File 51% of all workers' compensation claims. So, this is not just a problem for us to take care of, but it's a problem for us to all work on. So even employers have the opportunity for economic development. An interesting fact from the Center for Disease Control, this was from 2010, for every one prescription overdose death, there are 15 abuse treatment admissions necessary. 26 emergency department visits, and the bigger number is 733 non-medical users. And if we put that into the perspective of adults in Lorraine County, that means about 49,000 adults are non-medical users of prescription opioids, which isn't news from our lens, but that's a lot of people misusing prescription opioids. Thankfully, we just heard yesterday that the American Medical Association is dropping pain as the fifth vital sign. One of the things that happened in the mid-90s is they added it. When they take your pressure and they check your heart rate, they ask, are you in pain? And I could go to my podiatrist and claim I'm in severe pain, and I could get into the prescription opioid system quite rapidly. So I'm pleased to hear that they pulled it out, and so hopefully it'll get pulled out sooner rather than later. The National Survey on Drug Use and Health that came out in 2014 looks at people needing but not receiving treatment and people with meeting criteria. And we pulled this for our census, and I'll pull you way over to the right-hand side. The age 12 to 17, from the data, about 1,000 adolescents meet the criteria for illicit drug dependence or abuse, and about 959 adolescents meet the criteria for alcohol dependence or abuse. And moving up to adults, that could be about 27,000 and almost 87,000 for alcohol abuse, just for our population based on the national survey data. We need to look at the full continuum. We always want to just hit one piece, but if we don't have all this in place in our communities, from promoting the issues, promoting prevention, working universally, and then with targeted populations, case identification that we could do now better with schools and with medical systems, standard treatment, and then working towards long-term recovery and aftercare, including rehabilitation, is a map that our board has been focused on over the past, since we became a RUSC-focused community, but as we're also putting in place the continuum of care. Our board contracts with providers on an annual basis because that's how our funding flows, but we invest in programs over 2-year periods, because to do short-term outcomes for services, you have bumps and wiggles, but so we do a 2-year look with our outcome framework, and these are just some highlights of the past 24 months that ended June of 2015 for prevention. Through our work, we've matched 253 adolescents with mentors, and we know the value of mentors in the life of a child who needs more than one adult role model of what it can do to help them be drug-free. 40 adolescents increased involvement in after-school alcohol, tobacco, and other drug-free activities. Again, the power of giving them something else to look forward to doing instead of using drugs is important. 143 parents identified they'll provide clear, consistent expectations of non-use of alcohol, tobacco, and other drug rules and consequences for ATOD use. Again, that's so important. We can work with adolescents in treatment, but if the parents aren't in sync with the rules and the guidance, we've just undone any of the investments we've done for the adolescent, and so we've got to work that way. 219 adolescents perceived alcohol, tobacco, and other use as unacceptable risks for themselves. So they personalize, that what they've done is an unacceptable risk to change their behavior. We do preschool program. 308 preschoolers showed positive improvement in daycare program. You could see a theme, we're going earlier. We need to get the mindset changed and focused earlier so they could, take care of themselves, whatever the risks come around with them. And through our life skills, 6,300 students almost reported being free from alcohol and other drugs from the past 30 days of when they came through the program and followed through afterwards. And anytime you could push that movement forward out for kids, they've got better chances of going into their adulthood drug-free. Environmentally, at least 6 school districts in our county have implemented drug testing policies for their students. And 3 years ago, there was one barely thinking about it. And the first one actually was Vermilion, and it came from their students kind of requesting it. So we're impressed that the schools, that how they see their role with policy and education and prevention and referral to treatment. I mentioned Elyria to toughen their social host ordinance. We work with the Drug Task Force, and this past April there were 3,100 pounds of pills dropped off at the drug take-back this past summer, and a year ago there was a ton of pills. So there's a lot of, there's a lot of things we've got to do with reducing access and availability to help prevent, but also provide opportunities for positive role models. And I know you've had Darrell come in front of you. We had 650 kids from 11 school districts at the Rainy Rally again, but Columbus had like 1,200 kids in Columbus. We had about half that number just here of kids proclaiming they're drug-free in our county. We do work with local police departments for underage drinking, and this data is from fall 14. We are completing some soon. 18 citations out of 79 retailers. There are still some retailers with liquor permits that are selling alcohol to those under 21. So we have to work on that piece as well. On the treatment side, we're at an 18-month look at the time of this report because the data will end this July, because we kind of rotate our investments for prevention and treatment over rolling 2-year time frames. So this is an 18-month look at our treatment outcomes. 12 adolescents achieved abstinence, engaged in supportive relationships, and incurred no new legal charges from the treatment. 47 adolescents connected with and participated in at least one community support agency or activity and is abstinent at discharge. 46 adults received detox services and committed to their next level of treatment. 177 women received substance abuse treatment, including family treatment, parenting, trauma-focused, and were abstinent at discharge. 351 men received substance abuse treatment, demonstrated ability to sustain abstinence, and actively working their relapse plan. And 30 adults received ambulatory detox. This is something that just began, and it's physician dependent. The agency that had ambulatory detox is on their 3rd physician, and this one got it right. The first couple were kind of learning the model, but we see some promise in ambulatory detox if we have good supportive living environments for people to participate in that level of care. We are again included in Ohio's Access to Recovery grant. Ohio, this is ATR number 4. Ohio's been in it 3 other times. They added us again, and it focuses on the recovery support things while people move through treatment. Recovery housing, getting them their driver's license, if they want a gym membership, some other sober activities, employment skills, daily living skills, and those are with non-traditional treatment providers. So it gets people in our system more acclimated to what's available in the communities. We do partner with the 3 specialty dockets. There's a family drug, a juvenile drug, and a recovery court here. So our treatment...
And Veterans Court.
And the Veterans Court also. We're getting there with them. We are clear partners with these 3, but we'll move with the veterans piece on that. We are part of a United Way collaborative, which is the Common View, specifically with the Midview and the Clearview school districts. We are in the Healthy Kids Achieve More partnership with the Mental Health and Educational Services Center, and that goal is to coordinate professional development for all school personnel. So we all have come together and said, instead of each of us trying to do this, we're looking at the wholeness, the whole health of a student from their lenses. Project Dawn of Lorain County, we just opened the Modified Police-Assisted Addiction Recovery Initiative, and we do have family support for through Solace of Lorain County, which meets every other week in Lorain County. Data that just keeps coming up. This is from the CDC. We're still in the top counties for drug poisoning deaths. You can see we're in the highest, above 15 per 100,000. The way the colors look, it might be easier on that. I think I did black and white on your print. I apologize. But there's a SWAT that comes up from the east side of the state through Cuyahoga, Lorain, and then it kind of bubbles down the communities. And a lot of that has to do, I mean, we are the corridor, the 80-90 between Chicago, Detroit, New York, and you could read often of traffic stops on any of those with some major significant busts that happen. But not only that, it's the it's the prescription pills and heroin and fentanyl. Tom had just asked, are we going to see the epidemic hold? Last year, the CDC thought it was going to kind of level off in 2017, but that was before fentanyl, and that new synthetic is coming around. So we're not sure where that's going, but I do hope this removing of the pain is a vital sign helps curb something else that happens in our communities. While we've had Project Dawn over time, our overdose rates are kind of holding around the 60s since 2012. And this year, I think will be a year that, like no other, we're above 35 already for the first quarter. And we hear there are at least 1 or 2 overdose deaths a week. So
Are we tracking overdoses that aren't ending in death? Like people that are being administered the Narcan?
We're trying to get there with we do get the police reports from the Narcan usage from most police departments. We have not been able to get data yet from the hospitals. Our anecdotal with them is that, they get recycles 4 or 5 a night, and so we need to find a way to get those data points.
I think that would be
to
an
understand
astounding
that.
number, and people.
Absolutely.
This is okay, but that number
That's
is
a bigger
huge.
number,
Yeah,
right?
huge.
So we're still high. We're still too high. Any death is a death, and we're one of 88 counties in the state. And for us to just have that number and just doing the math of those other blue, counties in the state. We did look at the first quarter because, we heard the fentanyl, and that was, we were one of the top 16 counties where the state did the Stop Overdose campaign. They targeted those communities. So we wanted to look at what's going on, and you could see of the 34 deaths, 12 of them involved heroin, 20 at the time involved fentanyl, 8 were a combination, and surprisingly 14 included cocaine.
Yeah.
So, we can't keep moving our eyes when there's one piece and ignoring other drugs of addiction. And this even was started late last year when Project Dawn met. Our treatment providers were reporting that cocaine was coming back into our communities. So, and then just the mix, the gender representation, similar to our county. The average age is just unique, 34 to 60. Youngest being 18. So again, it just kind of cuts across every geographical border. These are just some interesting infographics connecting heroin. It's part of a larger problem. People who are addicted to alcohol are 2 times more likely to be addicted. Addiction is addiction. It changes the balance of the brain and the pleasure seeking and the sensation that people get by putting a drug into their system. And people who are addicted to opioid painkillers are 40 times more likely to be addicted to heroin. Just some facts you can use. And we're at the point and nationally that drug overdoses are killing more than cars, guns, and falling. So, in addiction, 4 out of 5 heroin users started out with prescription drugs. When we talk to the parents who've lost a young adult, none of them say, my child woke up and said, I wanted to become a heroin user. They often became an addict from another substance and then translated to heroin. Yeah, 1 in 15 people who take non-medical prescription pain relievers will try heroin within 10 years. The craving is just so immense and what it takes over their system. We've got to find a way to get help for them as we can. And a big piece it is in our medicine cabinets, is evidenced by the pills that are around. And hopefully, again, there's legislation that's going to change that. And so that's why we also know that abuse often starts at a young age. So when we surveyed our youth in 2014, they told us when they were drinking alcohol and marijuana, it was at weekends at friends' houses. But when they told us they were using prescription drugs, not for them, they were using them on weekends and at their own home. So it's important that we all lock up our medications or get rid of them to do that. And the power of prevention, 9 out of 10 people with substance abuse problems started using by age 18. So that's why prevention is so important. If we could, again, stop kids from even using substances, we could minimize, with other factors aside, substance abuse problems. There's now new statistics that every 25 minutes a baby is born suffering from opioid withdrawal. There was just a couple who gave birth to a baby who had cocaine in their system in the region. And so again, we've got to go all the way back to the neonatal components and the issues of that and the costs of, to hospitals for this. The baby stays 16 days costing $66,000 there versus 2 days for $3,500 stay. And multiple studies indicate that every dollar we spend on prevention results in about a $10 long-term savings. There is good news, the messages for kids are working for alcohol. So we want to say those numbers are going down for alcohol. We're doing some things right. Binge drinking is still around more for adults, and the Lorain County Health Assessment just has some interesting data about adults and binge drinking, which is where we're going to target. We, in fact, put in a grant application to address specifically high-risk drinking among the 18 to 20-year-old group, and so we hope we can get funding for that. So gaps, we have not had a publicly funded detox in Lorain County since 1997. Community Health Partners at the time is what it was, and they gave their contract back. It wasn't cost effective to do that. We know that there are new medications and guidelines from ASAM, the American Society of Addiction Medicine. They're effective to combat the opiate addiction. The issue is we need to find physicians that are interested and understand addiction. Like I said, the first provider they went through 3 physicians who just didn't understand addiction enough to understand that these medications can work with treatment, not on their own. Recovery supports, including sober living and peers, are proving quite effective in combating addiction. We kind of turned the curve. When I first started 20-some years ago, we had clients in residential treatment who successfully completed, became monitors, became, helpers, and they became certified clinicians. In the early 2000s, the state did away with that credential. And all of a sudden, everyone's realizing the value of peers again, and we're so thankful, but, had we not cut that off years ago, just think of what could have happened. So overdose deaths continue to be in the 60s since 2013. So when we did the math on that chart, on that CDC chart for, every overdose, you need 15 admissions, we feel as a board that we need to serve at least 1,000 adults for substance abuse, addiction, and treatment for opiates and heroin. Just to take that number and say, what would that mean? And part of it is because Ohio 2 years ago has now increased an obligation for counties to have a complete continuum of care for opioid addicted individuals, which includes detox, residential, intensive outpatient, and recovery supports. It was supposed to be effective September 15th. Columbus was not ready. They moved that to July 1st, but we're good, but we're not good in terms of how much of what do we have. So we check all the boxes that those services are available, but we don't have enough.
And Columbus gave you all the money you needed to address that, I'm sure.
Yeah, right.
Absolutely not.
Mhm.
Yeah.
No, yeah. So, so we hear from the Licata Way. They serve, see clients every day, and they feel that weekly about 12 to 15 individuals could benefit from detox. And that could be about 750 individuals. So we would need, just to serve what they see, we would need access to 11 detox beds. We talk about, do we need a facility or do we need access to beds? Or do we need access? So translating it, we would need access to 11 detox beds. Our contract with Stella Maris, they see 46 people. They don't have they only have 16 beds at their facility. So they're not going to dedicate 11 for Lorraine County and 5 for not us. So we do need to find a way to get more detox. To provide residential inpatient treatment, we feel in our formula at least 400 individuals could benefit from that as a step down. We would need 66 beds to serve individuals. And one of the pieces that's in the way from that is a IMD rule from 1965 that limits any residential facility from only having 16 beds. So we would need to have access to 6 or 7 facilities based on that number until Columbus or till Washington changes that formula for us. And we just had a really good focus group with 2 of our sober housing partners. And, you know, everybody feels that we need to cover at least the first 4 months of sober housing for people as they're stepping down. This is the time they're suddenly out of their treatment cocoon. They're moving forward into their daily lives. Some of them don't have access to food, for clothing. They're thinking about getting a job. You know, they don't have any cash in their pockets. So our thoughts, and it's similar with Access to Recovery, to kind of, if we had good supportive living arrangements with sobriety, about 4 months could help people move forward. And that's even in the national standards for sober housing. You know, you then step them down and they start paying more for their share. And so also to expand more peer supporters, which we've now moved peer supporters from meeting clients as they're getting out of treatment to moving them when they enter ambulatory detox. And our subacute detox providers are saying, could you put a peer in front of them over here and start helping them navigate their pathway? That's a capacity issue. You know, we've got to get more peers certified. We just had a class in April, and there were 21 residents that completed and passed their certification. So we've got to find a way to get them involved, and we're getting...
Isn't there one coming up on the 30th?
That's the Perry type. The peer supporter training is a 40-hour requirement from the state. There will be another one in August, and we're working with a group who's actually hosted those on the campus of LCC. And so we're able to work with them so we get more than 50% of the attendees can come from our county. So as we're trying to figure out what does this look like in terms of how much does this cost, you have it. This is stated as draft because we've been updating this through conversation with, when we just met with the recovery providers 2 days ago. Our board will finalize this in the next, at their next meeting, which I think will be Tuesday. We looked at, you know, what can Medicaid cover? What can, when we say ACA, we mean if people have insurance. Some people do have some insurance. We know with our adolescent residential facility, when kids go there for 60 to 90 days, insurance might pay for most, but maybe not the room and board for the kids to go. So there is some insurance in play. It's not a significant amount. And so we look at, you know, the indigent fund for that. We are also looking at details for adult treatment specific to detox, opioid, non-opioid, for adolescents, and then community support and prevention services. So I'll try to get through this. So we would like to see more ambulatory detox versus subacute detox. But again, we're limited now to physicians and availability and having the sober environment for an individual to go home to. So our formula right now is we're presuming of those 750, 80% will need a subacute detox level. So this is just how we're trying to formulate what could this look like to serve people in Lorain County. So once people get through detox, and that's about a 7-day stay. Again, it depends on the person. But so either way, the ambulatory detox, the difference is a person goes to a treatment facility in our county and they're in front of the physician and or a nurse and medically monitored for about 8 hours a day. And then they're released to a safe, supportive environment with their medications and they come back over time. So there is a lower cost for that. But that's still something that, you know, if we don't have as many physicians for, we can't open that up. So that's another piece of conversation we should have. We kind of looked at the opioid clients because of that 1,000, and plus for our mandate, we have to respond back to Columbus. What could that look like? So we feel that after detox, the best continuum for an opioid client should be stepping over into residential treatment and then stepping down to either a day treatment or an intensive outpatient with supportive housing. And most often with opioid addicts, they go from day treatment, which is 5 days a week, to then intensive outpatient for 3 days a week. They still need that tighter. Aftercare and relapse prevention, keeping them engaged for at least 1 hour a week for about 8 more weeks after they've gone through about 5 months of treatment, to keep connecting them. The medications, so again, the medications like Vivitrol, which are coming in, can be as effective while they're in treatment to keep their focus so they can go through their treatment. And case managing, checking in, giving them a Narcan kit or their family member a Narcan kit, again, as a safety net. They may have an urge to use, and we don't want them to die. And then thinking of a formula, about 80% of those clients, if they had good sober living arrangements, again, we've got them taken care of for 6 months to a year to help them on their way. So that's kind of a cost. And so what we looked at, again, we think about 400 people could go through residential treatment if we had more facilities. Technically, our clinicians would like to see more people in residential. But again, if we said we had more sober living facilities, we can balance it that way in our communities. The non-opioid treatment, the formulas follow similarly, but they're not as intense. We didn't think they need the day treatment, and they don't need the Narcan or the medication. So that's for people with alcoholism, cocaine, and other drugs.
I just think it's important for the taxpayers to understand just how expensive this fight is.
Yes.
Just when you look at the daily treatment cost of $225 a day.
Right.
And then when we can actually transition somebody's sober housing, then you're at $500 a month.
Right. Right.
So.
Yeah, and that's, our board has had, conversations about that. Those are all in numbers. So, the client, gets their child care, their transportation, their employment skills or whatever the messaging of the reality of what happens is something that we've got to look at. And then on the adolescent side, we estimated serving about 250 and thinking about 50 would need residential. New Directions, there are very regional focused residential facilities. The closest would be in Chagrin or Toledo for our kids, or Mansfield. We have a very good relationship with New Directions. The kids actually enroll in Orange School District, so they're receiving their schooling. The families are engaged. So the math for that is basically, some of them would receive residential, others would receive an intensive outpatient, which does include in-home or family connections throughout treatment, which are all evidence-based. Our board is conscious that we need to provide support for families through Solace. The coaches would really help, really engaging the faith-based system and really training them to be points of evidence and keys where families might go before they go here because of the stigma. Integrating the work we do with mental health, DD, children's services, and the court. Again, our kids cross multiple systems. So, we continue our investment with that. But so that's about placing kids in the safest environment where they can stay safe. So the clinicians make the determination that way, and the money doesn't drive their decisions. It's all about the safety of placing the kids, most often with the goal to return them home, but some kids can't go back home for a period of time. Coordinating with reentry is so important when inmates are being released, to make sure that the citizen circle is right there for them when they're ready to go out, that they don't have a good weekend of hanging with their old friends, connecting them right then and there when they get out, so we can hopefully get them focused into treatment. And problem gambling, I'm sorry.
Do the Vivitrol shot on when they get released, and we're having issues with that, I heard.
Yes.
Yes? But
Yes,
we're
we have
still
a
trying to
planning
do
meeting
that?
Friday. We're figuring out other ways to do that. We're working with other specialty dockets and other jails around Ohio that have been successful. So we hit a bump.
Yeah,
but-
I attended a thing down in Columbus. Actually, it was at Polaris for the Stepping Up
Stepping Up.
initiative, and the majority of the jails are doing that.
Right.
So I don't know why we're having such
It
an
might
issue.
just be a procedure or the way it's being communicated.
Okay.
So we're hoping we could start that.
That's an
Because
important
again,
step.
we could start that medically monitored, and then what Vivitrol does is it blocks the craving. So they don't have that urge that's overtaking everything they do to want to use right now, and that could help them focus on, here's my recovery plan, let's do it. So that's what, it's a one-time, it's expensive, it's $1,100 a shot, but it's one time, and it has proven effect.
Right.
So, yeah, we have a Friday meeting, so I hope we could do something with
I
that.
hope so, too.
You'll see problem gambling screening intertwined in here in prevention, and that's, Ohio does designate to county boards focus on problem gambling. And there had been research when the casinos were coming around that people with substance abuse addictions might often also have other addictions. And so they've designated that through our county systems. So we do have some focus to at least screen people who may have issues with problem gambling and do some community-based prevention for that recognition. Finally, our prevention, and again, our board, really learning the value of prevention as an investment here. Working with surveillance, town hall meetings just to get the conversation going. Specific campaigns are as important just because often as you might hear something or see something. Social media, the way we engage different community members. And then really working with evidence-based programs from newborn all the way up to grade level 10. We all started in the 6th to 10th grade. We need to back up and we need to start with earlier prevention services. So that's where our plan is specific to that. So I have that for you right now. Are there any questions? Are there any?
I called the auditor on Monday to
Yes.
find out if we got the figures back. Did you say
Yes.
you got them?
Yes, Teresa just
I
sent them
sent
over.
Oh, did you send them to me
Yes.
I got
yesterday?
in late yesterday.
Oh,
Yep.
late yesterday. Well, I didn't get it, so.
We do have
Do we have a grand total here what's the total for the,
the millage.
yeah, what is it going to cost a homeowner and how much is it going to raise?
Do you have those breakdowns yet?
I do.
You do?
Well,
need
I'm
to
sorry.
I just gave them to you.
Yeah, she just gave me the total
I mean, it's-
valuation. Okay.
You got them?
I do. So, yeah, and to be honest, our build was totally outside of even knowing what a mill would give us, which again, our number was 7.2. The 1 mill came back at 6.511. The 1.5 mill came back at 9.766. And then the 1.2 mil in the middle was 7.813.
And what was your total need
On this sheet,
that you presented? 'Cause 7 million
7.203.
a year?
Yes.
The
And we
first thing
know-
the
I'm sorry.
taxpayers are going to ask is they want to be assured that the money is going into helping people in services, not that it's going to be, staff heavy.
Right. Absolutely. I mean, yeah, and it will be. We're in a building that's been donated to us. We have barely 4 staff. So that will be taken care of by the state allocation to us. So it will really be for the plan, which may be tweaked a bit, but it's for services that start with prevention on the universal side and even on the outreach and engagement piece all the way through to sober supports. If this has been the theme of our board for a year and a half of this kind of framework, so I don't think they're going to change much on Tuesday of that detail.
Pretty expansive presentation, Ms. Jorgens.
Yeah, there's a
Thank
lot
you.
going on.
Thank you.
A lot.
Okay. Thank you for your time.
Yeah, and I think it'd be
Yes.
interesting to keep talking about without taking corrective action and being more progressive in this area that just the outrageous expense
Right.
that it costs. I mean, not outrageous from the standpoint of we need to help people to get their lives back on track, but just you're going to pay for it one way or the other. So
Right.
you might as well support getting the services and the treatment, because if you don't, it's going to cost taxpayers a lot of money. And in addition to that, maybe you won't have so many people breaking into homes and stealing items and families falling apart and divorces and all
Yeah,
kinds of issues.
All of the other
Right.
system issues. I mean, I still keep in my office a headline of a young adult at one of the Muni Court jails who begged to go to jail so he could get detoxed. So, it's like they're detoxing people every day there. So you're paying the cost of that. We're paying the cost of the jail to include that also.
Right.
So,
Or the health care.
Or the healthcare.
Yeah, there's so many things that,
right.
like you said, you're going to pay one way or the other. So let's get them healthy and back.
And get them to work.
Yeah, get them back to work, right?
Get their families together. Well, thank you. Thank you
Thank
all.
you.
Thank you, Elaine.
Mr. Ennis, do you have anything?
I do need a short executive session to discuss 2 matters of pending court action.
Commissioners report.
As I mentioned, last Thursday, I met with our Stepping Up team to prepare for our luncheon, which is going to be held tomorrow at the Transportation Center. I know, Mr. Kaler, you're going to be there, and Mr. Lundy, I hope you can be there also. We're trying to get all the stakeholders to attend the meeting. I had a good response from a lot of the police chiefs throughout Lorraine County, and they play a key role in this initiative, keeping people with mental illness and co-occurring addiction issues out of our jails and our prisons. This not only diverts people that are in need of treatment from being in jail, but it'll also save us a lot of money in the long run, seeing as it costs the county, $80 to $100 a day to keep these people in our jail. Sunday, we all attended the International Parade. It was really a lot of kids and a lot of people there, and it was very hot. Very hot. Parade marshal got everybody off on time, early on time.
That's right.
After the parade, I met with Kathy, a.k.a. Voltage, who came here before us for the Energy Up program. They came to us for a grant, which they did not get the grant, unfortunately, but they are still going forward with trying to do something here. They feel very strongly about these kids giving up their sugar. And so they are starting with a Lorraine pilot program with the Boys and Girls Club. It's Healthy Body, Healthy Mind, improving health education and prevention for chronic disease like cancer, type 2 diabetes, heart disease, proper nutrition and exercise. Healthy Mind, it will be hands-on activities and experience to inspire, motivate youth to create goals and moving forward for a brighter future that is attainable. Some of the things that I would like to help, I'm going to be helping them with this initiative because I truly believe in it and it's needed, is for monies from corporations for experiences. What it is, it's excursions to like the islands, hands-on art experiences. I was going to talk to Mr. Cortez about the Common Ground and zip lining, and just to expand this to the entire county and for these kids to take the pledge. And what it is 24 grams of sugar in a 24-hour period. So it's to educate our youth, and it's good for everybody in the county. So I did speak with Tom Stuber from Licata on Monday. We met to talk about some of these addiction issues going on in Lorraine County. And then Tuesday, we had Elyria Democrats had a little cookout this yesterday. One of the things that came from that was very exciting, Chris Pianowski from the prosecutor's office, thank you, was there, and he talked about he has finally hit the $5 million mark of collecting delinquent taxes in Lorraine County. This guy is working like crazy, making sure people pay their taxes, and it's helping the commissioners, but really, I mean, the schools are really benefiting from it. They had mentioned that they had a bump up in revenue, and they really weren't sure why. Well, it's, I think, thanks to Chris Pianowski for working so hard to get these people who are delinquent in their taxes to get on a payment plan and start collecting. So thank you to Chris Pianowski for a wonderful, wonderful job. End of my report.
And our treasurer also. Dan Telerik is part of that. So treasurer and
Right.
prosecutor's office
Right.
really going
Well,
after
he's-
these people.
yeah.
So
And thanks for our land bank who gave us that tool in our toolbox to make sure we have a remedy for those people who don't pay.
exactly. No. Again, it was a busy weekend. Congratulations to the International Festival, their 50th annual, put on by all volunteers. They did a wonderful job there. Yeah, just really busy. Coming up, though, July 13th, for everyone to know, at the Lorraine County Community College Spitzer Center is the Best of Lorraine County 2016. You can get your tickets online at pulselorainemag.com. It's always a sellout event. A lot of our great companies being showcased throughout the county. And everyone have a safe 4th of July this weekend. End of my report.
Yeah, enjoyed participating in the Lorraine International Parade. Boy, a lot of folks there. The weather cooperated, and there's Commissioner Kalo has a twin brother apparently that's a parade marshal over there, so looks a lot like him. But the event went smoothly. Always a lot of fun. Good to see all the faces. Had a chance to attend the MOVE rally the other day. Want to stress again that this board, all of us support transit. Just trying to work through what that programming will look like going forward. And I understand we still have our first public hearing scheduled for next week as well. And also want to stress again that this board had applied for and did receive a $100,000 planning grant. We're still waiting for word from the WACA on approved vendors so that we can start looking at which vendor will eventually be contracted to work on that plan. Also with the Lakefront Lorraine County group, we too are waiting for the final approval from the WACA on which vendors we can begin interviewing to make a determination on who we will work with to try to spark and stimulate more economic activity along our lakefront here in Lorraine County. That's all I have for now.
Just county offices will be closed this Monday to observe 4th of July. Board correspondence.
I move that we approve the board correspondence and waive the reading.
Second.
Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
Public comment.
Anyone wishing to participate in public comment this morning? Okay. Seeing no one wishing to participate in public comment, I would move that we recess into or go into executive session, discuss personnel issues that were outlined and also legal issues outlined by the assistant prosecutor.
Second.
Mr. Lundy.
Aye.
Mr. Kayla.
Aye.
Ms. Kowski.
Aye.
This has been a broadcast of the recent Lorraine County Commissioners' General Meeting. Unless otherwise announced, meetings are held Wednesday morning at 9:30 at the Administration Building, 226 Middle Avenue, 4th floor, downtown Elyria. These are public meetings, and you are invited to attend. Agendas are posted prior to the meeting at www.loraincounty.us. Click on Departments to see the Commissioners page, then click on View Agenda for a printable copy of the agenda.
I wish I was in school.
If only I had a math test today.
Or a book report to give.
I wish I was in school. I'll stay after class. I'll clean the chalkboard. I'll do extra homework. I'll skip recess. I wish I was in school.
I wish I was in school.
I really wish I was in school.
School ends, but free lunches for your kids don't have to. Find your local food bank at feedingamerica.org/summer meals for help. Together, we're feeding America.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help. And slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.